My name is Lý Trần Đức Anh. I come from Vietnam. Today I want to introduce COPD. As you know, COPD is one of the most common disease in the world and is a larger burden to society and is prevalence increasing in developing countries. And so, what is it? According to 2014, COPD, chronic obstructive pulmonary disease, a common preventable or treatable lung disease, is characterized by a persistent airflow limitation that is usually progressive and associated with enhanced chronic inflammatory response in the airway and the lung to nonsuch particles or gases and emphysema and chronic bronchitis are the two most common conditions that make up COPD. You can see the picture of COPD. Chronic bronchitis is an inflammation of lining of bronchial emphysema occur when the alveoli of lungs are destroyed. So the patient with moderate or severe limitation have occurrence of COPD exacerbation. Acute COPD exacerbation are identified by an increase in the patient of dyspnea, cough, and production or an prevalence of their sputum, and they can directly affect the patient's quality of life, morbidity, or mortality. So COPD is a larger financial burden on the healthcare system. The World Health Organization estimates that there were 600 million people worldwide with COPD in 2008, up to approximately 44 million in Europe. So COPD is one of the major diseases that are still in crisis. According to the global burden of disease conducted by World Health Organization and World Bank, COPD is currently the fourth leading cause of death in the world, with 2.75 million fatalities each year, representing 4.8% of all deaths, and is projected to be the third leading cause of death by the year 2020. In France, there are 3.5 million people with CTZ each year, and of whom 2 million are concerned about acute exacerbation. The total medical consumption of COPD patients in France was so big, 3.5 billion euro in 2010. In Vietnam, my country, COPD included the Health National Service Program, and there are 3.8 million Vietnamese suffering from COPD, representing 4.2% of population, and it's likely that an additional 2 million or more COPD cases undiagnosed. And the exact number of mortality in this country is hard to determine. So what are COPD risk factors? The most significant risk factor for COPD is long-term long-term cigarette smoking. The more pipe you smoke, the more years you smoke, the greater you risk. A pipe smoker, cigar smoker, or other who are exposed to second-hand smokers, second-hand smoke can be high risk. The combination between asthma and smoking increase the risk of COPD, and some popular other popular risk factors COPD, such as long-term occupation, personal exposure to dust and chemical fever. The people under 35 years old, or genetic factors such as alpha-1 antitrypsin deficiencies, poverty, poor nutritional status, or early respiratory infection. How COPD are diagnosed? In a clinical diagnosis can be considered in any patient who has a dyspnea or chronic cough or sputum production and a history of exposure to risk factor for the disease. And it is difficult that some symptoms of COPD and often don't appear until some sign of lung damage has occurred. So after that, they worsen, usually worsen over time. Yes, and patient can have a different signs such as difficulty sleeping or no interest in eating, lack of energy. The physical examination show a barrel chest, a decreased breath, sound, breathing, or some sign of right side heart failure. In order to confirm and support the diagnosis and give some diagnosis and give some prognosis, pulmonary function tests are recommended. There are 4 components, but in their spirometry is the most reliable way to determine reversible of airway obstruction. Other tests include post-bronchodilator spirometry, lung volume measurement, and diffusion capacity. We can measure arterial blood gases and or determine alpha-1 antitrypsin deficiency and perform lung biopsy, oximetry, chest X-ray, and CT scan can be used, but are not necessary for positive diagnosis. About treatment for onset of COPD, an effective therapy is available with control the system, reduce the complication, rate of complication, and reduce the frequency of exacerbation, and improve the patient quality of life. And the essential step, the most essential step in any treatment for COPD to stop on smoking, and it is the only way for patients who want a keep their lung from getting worse. The medication can be used as needed, such as bronchodilator, SABA, inhalers, steroid, or oral airway, oral way, yes, oral way, or antibiotics. They can have patient relax the muscle around the airway, and really some symptoms such as cough, softness of breath, and reduce the airway inflammation. Yes, and oxygen therapy. If there isn't enough oxygen in the blood, the patient needs a supplemental oxygen. About pulmonary heart rehabilitation, this program combine between education, exercise training, or nutrition advice, or counseling. The combinations are